Hello, it's Loren Scott-Lodge, clinical psychologist with the chronic pain psychotherapy team. If you've been referred to psychotherapy within the chronic pain team, you might be wondering what to expect. You'll be invited to book a time for an assessment over the phone or video link soon after you're referred, and in this assessment, you get to assess us too. We'll talk about what you'd like to work on in pain psychotherapy, and we'll also talk about what it is that we offer. If these two things match in the middle, then we'll make a plan for treatment. There may be a wait before treatment starts. If you think that what we're able to offer you isn't for you, you can decide not to continue. Similarly, if we think you could do with something we're unable to offer, then we'll let you know and we'll help point you in to the right service for you. Everything you talk about in pain psychotherapy is confidential, but there's some limitations to that you should know about. If you say that you intend to harm yourself or another person, or something you say to us says there's somebody in harm's way, then we can't keep that quiet. We will need to take that further. We also work as a team, so we share information between ourselves and other chronic pain colleagues that you might be working with at that time. If there are things you'd rather we didn't share, then you just need to let us know. Similarly, we write to your GP after our assessment sessions and then at the end of therapy to tell them what we're doing and how we're progressing. If there are things you'd rather we didn't include in those letters, you just need to let us know about that. We'll copy you into the letters so you'll always know what gets shared. Psychotherapists like a questionnaire, and we might ask you to fill in one or more quick questionnaires during our sessions. This gives us a chance to see if we're being of any help to you, because we'll be able to compare questionnaires before and questionnaires after. During our conversation, we might ask you if there are any significant events in your life history that we need to know about to give us some context. But we won't be asking you to tell us about your childhood. We will ask you about your pain story, what you understand caused it, how it developed over time, how it affects the way that you see yourself, and how it affects the way that you're able to live your life. We'll also want to know your aims and how you'd like things to be through doing psychotherapy. You are the expert when it comes to your life and how your body feels. As the expert, it's helpful if you take the point of view of a researcher. Imagine you with a white coat and a clipboard. Come with information to your sessions. Information about what you've tried and what you've found out about your pain, what makes it better or worse, what keeps it going, and what influence you have found that you can have on it. Once we've collected assessment information over 1 or 2 sessions, we'll use that information to make a shared understanding of what's going on, and we call that a formulation. We might give you some information about the most up-to-date science behind understanding persistent pain to give more detail to the formulation. It's important that you're in agreement with this formulation and that you understand it. It'll give us the basis for hypotheses or ideas about things you can carry on to try and influence your pain and your quality of life, and we'll put that into your action plan. To inform your action plan, you as the researcher might collect more data on pain, sleep or activity ratings, and that'll show us how things are progressing or where tweaks are needed. We might ask you to collect information about your thoughts and feelings, and we'll definitely ask you to experiment with new skills or test out ideas that we come up with in the session. It's helpful if you take notes to report back in the next session, and feel free to take notes during the session too. To get ready for assessment or treatment sessions, it's important that you make sure that if you're on video or phone that you're somewhere where you won't be disturbed and you can speak privately. Make yourself as comfortable as you can, even if you are in pain, so that you're able to focus on the session. Please switch off your radio or your TV too. It's helpful to dress like you're coming to a clinic appointment, even if you're at home. And have a notebook and pen to jot down key messages and between session plans. I hope this explains what to expect when you come to pain psychotherapy, and we look forward to working with you and to where your research and your experimentation will take you.